Hi! Today on this video I'm going to be talking about the American and the Canadian healthcare systems. Full disclosure, I'm a Canadian, so I apologize in advance if I don't give you a balanced view of the two healthcare systems, but I'm going to try my best. And I'm going to be really comparing the American system to the Canadian one in terms of the 5 principles that are already present in Canada. So that's your principles of comprehensive, universal, portable, accessible, and public administration. And I'm going to be really looking at the two systems, especially the American one, comparing it to the Canadian with the proposals that are already in effect and are going to be in effect as proposed by the PPACA, which is the Patient Protection and the Affordable Care Act, commonly known as Obamacare. So the United States of America and Canada have numerous similarities. They have similar culture, similar geographical location, and similar language. Despite these similarities, the two countries address healthcare very differently. With the introduction of the Patient Protection and Affordable Care Act, which I'm going to, from here on out, be calling the PPACA, the American healthcare system is becoming more similar to the Canadian one. This video is going to examine how the current system in America, accompanied by the proposals made under the PPACA, compares to the principles of Medicare currently present in Canada, and I just mentioned what those were. If you want a more detailed lowdown on what the principles of Medicare are, you can look at the Canadian Health Act, which was published in 1984. Canadian Medicare embraces the principle of comprehensive healthcare. Canada's healthcare system covers all medically necessary health issues, including all procedures performed in hospital settings and anything else deemed necessary by a province. Therefore, Canadian health coverage varies only slightly between the provinces, while the American system varies greatly between health maintenance organizations, or HMOs. The PPACA seeks to reduce this variation with the introduction of standards for HMOs. HMOs are required by the PPACA to cover all medically necessary issues, for example, newborn care. These requirements promote the reform of the American healthcare system towards a more comprehensive one. The PPACA, moreover, pioneers the notion of universality in American healthcare. However, in Canada, universality is not a novel idea. Universal healthcare was introduced by the Canada Health Act in 1984 and covers 100% of the Canadian population. In contrast, 49.9 million Americans were uninsured in the year the PPACA was introduced, which is 2010. The PPACA contains an individual mandate aimed at reducing this figure, and that number comes from the United States Census Bureau in 2011. The individual mandate, accompanied by other provisions outlined by the PPACA, will provide insurance for 94% of Americans. And that's just an estimate, obviously. This individual mandate requires the payment of a fine if an American does not acquire health care insurance. Exceptions may be made for a variety of situations as expected, so one example being religious excuses. So if all Americans without excuse must have health insurance must become more accessible to its citizens. Accessibility is an intrinsic principle of the Canadian healthcare system. In Canada, financial barriers are eradicated by the removal of user fees and extra billing. Moreover, Canadian healthcare coverage is free from discrimination. The PPACA addresses this issue of discrimination by forbidding HMOs from basing premiums on anything but age, geographical location, family structure, actuarial value, tobacco use, and participation in a health promotion program. This abolishes the notion of pre-existing conditions and various other biases which would restrict Americans from obtaining health insurance. Another way the PPACA addresses the principle of accessibility is through the American Health Benefit Exchanges. These exchanges will be established by individual states in 2014, so next year, and they allow citizens to directly compare insurance plans. One intent of these exchanges is to create a competitive market that's supposed to drive costs down, and the quality of insurance plans up. Other ways the PPACA will help Americans get coverage include federal subsidies, expansion of eligibility for Medicaid and Medicare, depending on the state. Notice the difference between American Medicare and Canadian Medicare. They're very different. As well, the PPACA proposes penalization of both insurance companies whose premiums are too high and employers who do not provide health benefits for their workers. By increasing the accessibility of healthcare, the PPACA once again is ushering America towards a healthcare system more similar to Canada's. However, with such an increase in accessibility, does not a dramatic increase in federal expenditure also ensue? The sustainability of accessible healthcare concerns both America and Canada. The Medicare Protection Amendment Act in 2008 in British Columbia directly addresses this issue because it is such a grave concern. The amendment states that the ability to pay for the healthcare system should exist in the future. In America, the PPACA also addresses this issue of sustainability. One way the PPACA proposed to reduce deficit is through upstream healthcare. So upstream healthcare refers to dealing with cases before they even occur. So promoting health and preventing disease are really what upstream healthcare is all about. A number of initiatives described by the PPACA will increase America's efforts in the area of health promotion and disease prevention. With its many proposals to sustain the American healthcare system, the PPACA has a dramatic effect on federal expenditure. In fact, if America had repealed the PPACA, federal deficit would increase by $119 billion between the years of 2012 and 2019. And that figures from the Congressional Budget Office in 2011. In comparison, with acceptance of the PPACA, federal deficit will decrease by $132 billion over the same period. That figure is also from the Congressional Budget Office in 2011. Even when backed by such astonishing federal savings, the PPACA remains controversial, mainly because it involves an individual mandate which requires people to buy health insurance. And also, it's a more socialist system, which reduces the profit made by the privately owned HMOs. As a result of the lucrative HMOs, the principles of accountability and public administration are affected. Unlike America, Canada's healthcare system is publicly administered and run on a non-profit basis. This means that Canada's Medicare expenditures are readily available for scrutiny, ensuring the system maximizes its efficiency. Apart from government-run programs such as Medicaid, the principle of public administration is not readily found in the American system. Profit-based healthcare is normally efficient or accountable. However, the most beneficial care may not be provided due to this entrepreneurial mindset. The PPACA addresses the principles of accountability and public administration with its section on transparency and program integrity. This section contains stipulations aimed at maintaining integrity in both the public and the private healthcare sectors. Some highlights include an act aimed at reducing elder abuse, as well as many provisions to reduce fraud. This novel transparency will provide a clear indication about how money invested is being used. And as the American healthcare system becomes more transparent, it appears more and more similar to the Canadian system with regards to the principles of accountability and public administration. The last principle of the Canadian system is that of portability, which ensures Canadians are covered across the nation. Since Canada uses a centralized healthcare system, this is much more plausible than the American system, which utilizes many various HMOs. In America, portability is variable because some HMOs are regional while others are national. The Veterans Health Administration program is a nationwide program that ensures portability of healthcare, whereas Medicaid is subject to state design and therefore does not ensure portability. Consequently, whether healthcare coverage satisfies the principle of portability depends on the HMO. The principles of a comprehensive, universal, accessible, sustainable, accountable, publicly administered, and a portable healthcare system are all currently found in Canada. The reforms proposed by the PPACA address many of these principles, which has reduced the number of differences between the American and the Canadian healthcare systems. This healthcare overhaul really has begun the reformation of the healthcare system that one day might pull America out from its spot as the only industrialized nation lacking universal healthcare. So I hope that was informative, and I hope you learned something, and I hope you enjoyed this video. Thank you.